Good afternoon, everyone. We appreciate you being here as we discuss this very important topic. Today, Jefferson County Public Schools is announcing the launch of our anti-vaping campaign that's called Vaping Equals. So we're thankful for the support of our community partners. One of the partners is here with us today to talk about the dangers of teen vaping, and she's with the Foundation for a Healthy Kentucky. Bonnie Hackbarth is here talking about the statewide initiative to educate teenagers about the dangers. So we thank you for your support. You'll hear more from Ms. Hackbarth coming up in just a few minutes. Another one of our great partners that we have here with us today is Mayor Greg Fischer, who is invested in the health of our young people and the city of Louisville. So Mayor, we welcome you and thank you.
Thank you, Renee, and good afternoon, everybody. From day one of my administration, we've been focusing on three key values: lifelong learning, compassion, and health. And health in terms of mental health, environmental health, and physical health. Because we know if you can live in a city where people are always learning, everybody's healthy in all regards, and everybody's helping each other in a compassionate way, that's a great city to live in. And that's a nice timing for it because we just completed our Give a Day week, and people across the city, and many of them JCPS students, helped us break our world record for volunteer acts and compassion acts, which every year it keeps growing. So we're very grateful for that when all of our city values come together. And then we're always obviously looking for city partners that also understand these values. And we've got no greater partner than JCPS in many ways. But today's announcement around Vaping Equals is really coming at an important time, not just in our city, but in the country as well, as we educate students about the serious health consequences of using e-cigarettes and Juul to discourage them from using these products. It has not taken long for these products to really take on epidemic proportions in terms of our health issues and health scares in our community, in our country. According to the CDC National Youth Tobacco Survey, the use of e-cigarettes among young people has surpassed the use of conventional cigarettes since 2011. In less than a decade, this new product has taken over the already bad practice of smoking cigarettes. Dr. Lori Kaloya, the medical director of our Department of Public Health and Wellness, is up next, and she's going to tell us why, on the data behind this, is why this is such a disturbing trend and why this clearly threatens the health of new generations of Americans. In Louisville, we've recognized this threat. In 2017, we included e-cigarettes and hookah products under our city's smoke-free ordinance, which now prohibits smoking and vaping in all indoor public places and work sites. We did this both to protect this non-smoking and non-vaping public from the harmful effects of secondhand exposure to toxins emitted from e-cigarettes. We also did it to discourage vaping, particularly amongst our young people. And City Health, which is a national organization that rates the nation's 40 largest cities based on health policies, recognized our city for taking this step. I also want to point out that I'm grateful to JCPS for their strong smoke-free policy that prohibits tobacco products and e-cigarettes on school grounds and school activities. Folks, this doesn't take a lot of deep science to know the harmful effects of everything related to nicotine and tobacco and vaping. Those days of arguments are hopefully long gone, and our job should be to eliminate as much of this as possible. And then I'm also delighted that the whole state's coming together on this with the leadership of a Foundation for a Healthy Kentucky. Bonnie, thank you for being here today. The Kentucky legislature passed. Representative Jerry Miller is here today, so thank you, Mr. Representative, for your leadership on this issue. And then the governor signed a similar measure that will prohibit tobacco and e-cigarette use on school grounds throughout the state. So these are good steps for us. And then just last week, Senator McConnell announced that he will introduce legislation aimed at raising the national smoking age from 18 to 21. The bill will be introduced in May and will cover all tobacco products, including vaping devices. So this is all good news. We will always work with our local public health leaders to add their voice to that bill as needed. We want to make sure that the public health community and their voice and agreement is behind Senator McConnell's bill. I also want to give a shout out to our One Love Louisville Youth Implementation Team. I get together with them every 2 to 3 months. They're an advisory group of young folks aged 16 to 24. They brought up this issue of vaping to me as a serious concern at the beginning of the school year when I asked them what are some of the biggest issues that you guys are thinking about that are harmful. They brought up teen suicide, and then they brought up the danger of juuling in the classroom or on the campuses, and how many kids that they go to school with in high school that are getting addicted at such an early age. So I want to say thank you to our youth implementation team. So obviously a lot of momentum behind this. Thank you, Dr. Polio. Thanks to JCPS for being great partners to our city. And thank you for launching this new Vaping Equals campaign and for all the great activities that you do each and every day. Our public health and wellness team has been on the ball with a lot of different good activities. When hepatitis A came into this part of the country, our public health and wellness department was all over it. The Center for Disease Control said Louisville's Public Health and Wellness Department was the gold standard for responding to this epidemic. So I'm really grateful to everybody. We've got a lot of staff members here from Public Health and Wellness. So thank you all so much for the good work that you do. And now I'd like to introduce Dr. Lori Kaloa, the Medical Director of Louisville Metro Department of Public Health and Wellness, and she will share some of her thoughts with us. Dr. Kaloa.
Thank you, Mayor Fischer. As the mayor said, the use of e-cigarettes among young people has surpassed the use of conventional cigarettes for the past 8 years. The 2016 Surgeon General's report stated that e-cigarette use among high school students has increased an astounding 900% from 2011 to 2015. In 2015, nearly 38% of high schoolers reported having tried electronic cigarette at least once. Regular use of e-cigarettes among U.S. high school students increased from 11.7% in 2017 to 20.8% in 2018, a 78% increase. This is very concerning from a public health perspective. Let's be clear. E-cigarettes and devices like Juul contain nicotine, often at rates higher than in conventional cigarettes. Their goal is to get users hooked. According to a 2018 report from the National Academies of Sciences, adolescents who used e-cigarettes are more likely to transition to traditional cigarettes. There's a public health crisis forming if we don't act now. The CDC projects that without a trajectory change, nicotine addiction and tobacco use will dramatically shorten the lives of as many as 5.6 million of our children alive today. This crisis could wipe out decades of the progress we've made in declining smoking rates across the United States. And if that weren't enough, the 2016 Surgeon General's report also raises concerns about the effects of nicotine found in electronic cigarettes on the brains of young people. The Surgeon General said, and I quote, "The brain is the last organ to fully develop. Brain development continues to the mid-20s. Nicotine exposure during periods of significant brain development, such as adolescence, disrupts the growth of brain circuits that control attention, learning, and susceptibility to addiction." In spite of all I've just laid out, I'm encouraged to see all of you here today to help implement this campaign to educate JCPS students to the health dangers they face from e-cigarettes, including Juul and other devices, and to discourage them from using these products. I'm also encouraged hearing about all of the other initiatives the mayor's told us about today that are going on in our city and across the state. I'm confident that working together, we can give our young people a healthier future in a city where everyone and every community thrives.
Thank you, Dr. Kaloa. And Mayor Fischer, we appreciate the invitation to have this here and to be partners with the city. I come at this from two important angles. First of all, as the parent of a teenager, I have a 14-year-old daughter, and anecdotal evidence and conversations with her, I know that e-cigarettes and vaping are very common amongst teenagers throughout our community and throughout this nation. And so it's important for me to have conversations with her, but to also, as superintendent, know that I have to act on this. Second of all, as a former principal. When I first became a principal in 2007 at Jeffersontown High School, and I know throughout this district, it was a challenge at that time in preventing students from smoking cigarettes. And that was something that as a principal that we battled often, smelling cigarette smoke, whether it be inside the school or outside the school. But as my time went on as principal over the course of a decade, we really saw a dramatic decrease in the amount of cigarette smoke that was taking place at schools. I'm not saying it's completely eliminated, but it just we did not see it at the same rates as the years went by from 2007 to 2017. And I know Dr. Aberle at Atherton probably sees the same. However, during that time and towards the end of me being a principal, we saw a dramatic increase in the amount of e-cigarettes, vaping, or what is commonly known as juuling taking place amongst students throughout our community. And this was an important thing for us to make sure that we begin to address and most importantly to educate through this campaign. Over the course of the last several months, I've also had a couple conversations that really drove me to say we've got to do something about this as a district. Many months ago, as Mayor Fischer detailed with his youth implementation team, we had conversation when he meets with them and gives me feedback about some of the things that they've told him. And one of the things in that conversation was around how much vaping is happening with youth today, and it would be important for our schools to begin to educate our students. And then secondly, I had a lengthy conversation with our board member, Chris Brady, some months ago where we talked also about this particular issue. Chris was very instrumental, as was Diane Porter, our board chair now, in passing our smoke-free campus policy several years ago, which e-cigarettes was a part of, and is a part of this policy. And so we think we're leaders in this. But now it is the time to act and make sure that we raise awareness around this issue with families and parents and students, that all of our stakeholders understand the health risks that are in place with e-cigarettes and juuling. It becomes much more difficult. We don't have the same smoke that we see, the same smell that we see, and it is very clear from some of the flavors that are marketed that this is directed straight towards youth and students. And so it is important that we bring awareness to this issue with our families and our students. As Dr. Kaloya said, the amount of nicotine that is in one of these Juul pods could equal as much as 20 cigarettes. And so our students need to know this and be very aware of this, the health risks involved in nicotine. But as she also said, the brain development on adolescents, this is so powerful, and we have to make sure that we treat this as the health risk and crisis that it is. So in JCPS, we will be doing two things. First of all, raising awareness through a poster series, including the ones you see up here. They will be distributed to all middle and high schools throughout JCPS, placed in high traffic areas and restrooms throughout our schools and each and every one of our middle and high schools so that we can alert our students. And then we will begin to add this to our health curriculum in skills-based lessons to explore the consequences of vaping on health and the harmful effects of e-cigarettes, but also how companies and industries target our young people and equip our students with strategies to make sure that they know the effects of e-cigarettes, vaping, and juuling. Finally, we will be working with parents and community members so that we can raise awareness so families can have discussions with their children and talk about this important topic. So we've got a lot we are doing to address this. We're proud of the work we're doing. We once again want to be leaders in this work throughout the state, but it is important that we address this issue with our children so that we can reduce e-cigarettes like we have done with conventional cigarettes. Thank you for coming, and at this time I'd like to welcome Bonnie Hackbarth from the Foundation for a Healthy Kentucky to discuss resources her organization has worked to create to help end vaping among teens. Bonnie.
Feels like old home week. It's good to be back here in the company of JCPS and in the Metro Louisville Health Department. I've been blessed in my life to do work that I feel like makes a difference, and so I'm happy to be here with you, Superintendent Polio, Mayor Fischer, Representative Miller, board members. It's good to see you again. The JCPS Vaping Equals campaign will provide important information to students, faculty, staff, and parents to help them understand the true dangers of teen vaping. Recently, the CDC released data that was quoted by Dr. Kaloya that 1 in 5 high schoolers and 1 in 20 middle schoolers were vaping in 2018, and that's a 78% jump for high schoolers and a 48% jump for middle schoolers in just a year. We think it's even higher in Kentucky because we started out higher in terms of teen tobacco use, and we'll be looking forward to the numbers that come out later this spring to let us know what's happening. In the meanwhile, however, the Foundation for a Healthy Kentucky wanted to know if the numbers we were seeing at the national level were in fact being reflected in Kentucky. So we worked with Kentucky youth advocates to conduct focus groups in 5 high schools around Kentucky, including one here in Jefferson County. And here is what the kids told us. I put this sheet out for everyone, so it's back there on the back if you want to see it. It sort of summarizes what we heard. But this is what kids told us. They said, vaping is rampant. The kids told us that as soon as a teacher's back is turned or a teacher leaves a classroom, that e-cigarettes literally start flying across the room and kids are immediately starting to take vapes and hits. The school bathroom is now the jewel room. Second thing, parents and teachers are largely clueless. Partly because the devices are designed because they're to be really easy to hide. You can hold it in the palm of your hand, you can stick it in your watch band, and nobody even sees them. Okay? And also because they come in kid-friendly flavors. Flavors like unicorn vomit, bubble gum, popcorn. These are not flavors designed to help a 35-year-old quit smoking. These are clearly targeted to youth. The kids also told us they think e-cigarettes are cool. You can get skins for them. You can personalize them. And like I said, they come in flavors. Truly, e-cigarettes are nicotine disguised as dessert. We also heard that once the e-liquid is gone, kids can then refill the pods with something else, like marijuana or other illicit drugs. And finally, and perhaps most frightening, the kids told us they think e-cigarettes are safe. Why do they think so? Because that's how they're marketed. The industry has marketed these products as a safer alternative to cigarettes. Now, if you're an adult who smokes, that might be the case. The FDA has not yet concluded that they are worthy of being called a smoking cessation device. And that's partly because the nicotine is unregulated. You don't know how much, you can't regulate the exact amount that you're getting. But kids think they're safe. They think it's just water vapor. We heard that over and over and over. So we are, in fact, seeing an epidemic of youth vaping, not only nationwide, but right here in Kentucky as well. And so if we're going to stem this epidemic, both statewide and in Kentucky, we're going to have to help kids understand just how dangerous these devices are. And that's why the foundation yesterday launched a new PSA campaign and a website and an Instagram page called I Just Didn't Know. Because that's the other thing that we heard from kids all over the state. I just didn't know that they were chock full of nicotine. I just didn't know that they had carcinogens and heavy metals. I just didn't know that they were not safe for kids. I just didn't know that they could rewire my brain permanently. So that's why this JCPS campaign is so important as well. These campaigns are about helping kids understand that e-cigarettes, vapes, Juuls, whatever they call them these days, are the most effective delivery device known to men for introducing the most addictive substance on the planet to your body. Vaping is putting a whole new generation of teens at risk of nicotine addiction, and we all have to step up to stop it. Dr. Tom Aberle is principal at Atherton High School, and he's going to share with us the youth vaping epidemic from his perspective. Dr. Aberle.
Hello. I appreciate this opportunity to speak on behalf of many principals across Louisville. I've been a high school administrator since 2001, and I remember back in 2001 we had, I believe the statistics say over 20% of our teens were regular smokers. And since that time, I was part of watching how effective the anti-smoking campaigns were to decrease our teen smoking below 10%, I believe. And I can tell you, as a witness to what's happening within the schools, both with what we're finding with our students who are engaged with it, or possessing these devices, or other students who are talking about what's happening among their peers, that what you're hearing from these other professionals is very true, very valid, and honestly, I think our students would say it's an underestimate of what's really happening within the schools. So really, and this has happened really since over the last 12 to 20 months. So this is something very recent that's growing exponentially among our youth. And frankly, I think it's the adults who are learning now to understand the terminology, to understand these different tobacco nicotine delivery systems, and the impact that they have on our children. We had a pediatrician come speak to nearly 500 of our students in the fall, and I can tell you they were very engaged in understanding the level of addiction that occurs through nicotine in the young adult brain, as well as the intentionality and targeted marketing by the tobacco companies to our youth. So what I really wanted to speak on behalf of our schools was to reach out to our parents to understand what these nicotine delivery systems look like, how they operate, have conversations with your children. Like Dr. Polio, I myself have a 13-year-old that I have regular conversations with regarding these tobacco delivery systems. And we hope that our community will embrace the strategies that we're taking to bring awareness to deter our young adults from engaging in these behaviors.
Thank you, Dr. Aberle. And I think to really highlight what these devices look like and how students can easily have them and parents not even know what they are, we have some of the devices up here that were actually found at some of our schools. And so you can see, we want parents to see what they look like so they can understand as well. So thank you, Dr. Aberle. We want to recognize our board chair, Diane Porter. Thank you for being here. And our board member, Chris Brady, we appreciate you being here. Also want to say thank you to the Louisville Metro Health Department for hosting us today. We greatly appreciate that. And to close out our program, you've heard from a lot of adults about the importance of this message. We wanted to make sure that you also heard from our students. So we have fifth graders who are here today from Young Elementary School. And not only is this issue important to us as grown-ups, but it's also very important to our students. Please welcome our fifth graders from Young.
Hi, my name is Kenny Navidad, and this is Larry Todd, and we're from Young Elementary School. We did this for our IB exhibition project about teen vaping. We learned the effects of vaping, what is vaping, and how and why do teens vape, and how to quit vaping. We chose teen vaping because there are a lot of teenagers who are vaping, and we want to help make a change.
For our project, we decided to make a website with our research. We made a video to show teen vaping and why they should stop. We also made flyers, and we called middle schools and high schools to ask if we can hang up our flyers to encourage teens to stop vaping. We also presented our project in front of a fourth grade class, and then we presented at our exhibition night. I think the teens should stop vaping because it can hurt them.
Let's end vaping together.
was great, guys. Thank you so much. And I can't say it any better than them. Let's end teen vaping together. We appreciate your support in helping us to get out this very important message.